Okay, in front of you, you see a vertebral column and a pelvic girdle. You should know from the laboratory work so far that there are 5 different types of vertebrae. There are superiorly the cervical, thoracic, inferiorly are the lumbar, and then the sacrum, and then most inferiorly is the coccyx vertebrae. The point of today's lecture is for us to analyze the most distinguishing characteristics, or some of the distinguishing characteristics between individual vertebrae. For this laboratory, you'll never be asked to identify or distinguish between, for instance, the 4th cervical vertebrae and the 3rd cervical vertebrae, but you will be able to asked to identify the type of vertebrae that this vertebrae is compared to this vertebrae. So distinguishing between types of vertebrae is critical. Individual vertebrae within a group is not as critical. Having said that, there are 2 vertebrae that are special, and those are and they have special names. Those are the atlas that I've just marked, and just below it is the axis. The atlas is the vertebra that articulates superiorly with the occipital condyle on the skull. So this surface right here is the superior articular surface that articulates with the skull. That's the occipital condyle. These are paired surfaces. You also see that in the atlas there's a very large central foramen, the vertebral foramen, and then on either side you see smaller transverse foramen. So there's a foramen there and a foramen there. In the case of the vertebral foramen, the main spinal cord goes down through there, and there are some spinal nerves and blood vessels that come down through here, through the individual transverse foramen. So the main distinguishing factor of the atlas is that it's got this superior articular surface that articulates with the occipital condyle of the occipital bone. It's got a very small, small and discrete body, and then it articulates inferiorly with the axis. The axis is larger, it's stouter, and it also has a thing called the dens, this projection that is being blocked partially by the atlas. This projection allows for the head to rotate on its axis, and hence the name. The axis, as I said a minute ago, has a larger body than the atlas, but it has an identical transverse foramen on either side. So again, the main distinguishing factors of the cervical vertebrae is that they have small bodies. Here's an example of a small body, another small body, and then the 7th cervical vertebrae also has a small body relative to the other vertebrae in our column. They have a central foramen, the vertebral foramen, and then they have transverse foramen, a transverse foramen on one side, a transverse foramen on the other side. And then posteriorly, and as we're rotating it, you can see the transverse foramen on the 6th vertebrae, 6th cervical vertebrae, the 7th cervical vertebrae, and then you see inferior to that, it stops. As we pull away a little bit and we go up, we can see that the cervical vertebrae have something called a spinous process. It's a small spinous process, and the spinous process is called bifid. It's separated. It's V-shaped. So the cervical vertebrae also has a V-shaped spinous process. Unlike the cervical vertebrae, the thoracic vertebrae does not have a bifid spinous process, and in fact none of the vertebrae do. And they don't have a transverse foramen. All vertebrae have a vertebral foramen in the center, and in this case now the thoracic vertebrae have a very stout body relative to the cervical vertebrae. So continuing on down here, we're going to go down to the approximately to the, so here's the 12th thoracic vertebrae. The thoracic vertebrae, also the main distinguishing feature of these vertebrae is that they have a spinous process, not a let me see. They have a spinous process that projects posteriorly, and the spinous process, they also have a transverse process, unlike the other vertebrae. The cervical vertebrae had a transverse foramen. The thoracic vertebrae have a transverse process. The transverse process is a main point of articulation with the ribs. So a main distinguishing factor of thoracic vertebrae is that they articulate with the ribs. The ribs will have a surface associated with the posterior portion of the body as a point of articulation for the ribs. That is called a costal facet, or in some cases a costal demifacet. Now, inferior to the thoracic vertebrae are the larger, very large, relatively speaking, very large lumbar vertebrae. Lumbar vertebrae have a couple of distinguishing features. First and foremost is they are very, very large and stout bodies. They have a central vertebral foramen, and as and their transverse process is rounded. I'm sorry, their spinous process is rounded, and it's very very stout. It's not very long. It doesn't project very far out. The other aspect of the lumbar vertebrae is the inferior articular surface is projecting forward. The superior articular surface is projecting posteriorly. So for the lumbar vertebrae, the articular surfaces are projecting anterior, posteriorly, respectively. Inferior to that is we have the sacrum, and I'll say a couple of words about the sacrum in a second, and then we have the coccyx. The coccyx is the tailbone, and it's the little dangly thing. The sacrum is a very stout portion of the vertebral column. The sacrum has, I'm going to take away some of the bony pelvis here, has a couple of surfaces. It has a superior articular surface with which it articulates with the lumbar vertebrae here. It has a ridge that is posterior to it, and that ridge here is the central ridge of the sacrum here. And then on the right hand side there, this joint right here is called the sacroiliac joint. The sacroiliac joint is this portion right here is the ilium of the pelvis, which you'll learn which you've already learned, and this is a sacrum, hence the name sacroiliac joint. And finally, the other aspect of this to recognize is that when you're looking at this bone, the sacrum, if it's flared in, the sacrum is flared in ever so slightly so that it forms the pelvis. And we'll talk about the true pelvis and the false pelvis. Well, the sacrum is flared ever so slightly in like this. So this is the anterior surface of the sacrum, and where the ridge and the crest is the posterior surface of the sacrum. Okay, and with that we'll stop right here.